I'm going to first start with quite an important technical point, which is that obviously in this case where the margin of error was virtually zero, we decided to use a surgical guide. Now there are different types of surgical guides. Let me show you the type of guide that we used in this particular case. The surgical guide that we used in this particular case has got advantages and disadvantages. I decided to use this particular type of guide because from the outset I only needed the surgical guide purely for the positioning of pilot holes. The rest I was going to do freehand in a technique that I will describe to you in a few minutes. The one thing that is important with surgical guides is that you test them in the patient's mouth prior to surgery. And this is what precisely happened in this case. So even though these surgical guides are supposed to be precision fitting, when I tried it in the patient's mouth, there were 2 or 3 places that didn't allow it to seat properly. This is paramount to a surgical guide. You need to be able to seat the surgical guide precisely and have windows where you can check that the contact points are in position at the outset of treatment and also whilst you're drilling your pilot holes. If there is even a slight discrepancy, and especially in this kind of case, it can lead to catastrophic consequences. From the outset, when I tried this surgical guide in this patient's mouth, there was 1 or 2 little catches. We adjusted those and we were able to fit it properly prior to starting surgery. This is a lot more complicated when you're in the middle of surgery trying to correct a surgical guide. You've got acrylic, and acrylic and open surgical sites don't mix too well. We place the surgical guide in position, and the first thing that is important to note is that this surgical guide is sitting properly. And there are a few observational windows. The first was in this area. That was your second point of contact. The third, we made sure that there was no gap distal to this area. These surgical sites were carefully chosen from the implant planning that we previously showed, and they were for the exclusive use in this particular case only for pilot holes.